Well, first responders have to be constantly training to provide the highest level of care in the most critical situations.
MTN's Lindsey Ford witnessed firsthand what that training entails during a simulation with crews on the ground and in the air.
When Reach Air Medical Services team hears this sound,
Reach 205, scene flight request.
They race to the helicopter to respond to an emergency.
From the moment the tone goes off, my partner and my pilot and I are thinking safety first.
Before the helicopter leaves the ground, the team checks weather conditions, equipment.
My partner and I kind of strategize about what we're going to need on scene and how we're going to run the scene.
Crystal is a flight paramedic with Reach Air Medical Services. She's been flying for 3.5 years and has worked as a paramedic for 17 years. In Wednesday's simulation, firefighters are ready on scene, stabilizing the patient. In a rural state like Montana, time is critical. Sometimes the nearest hospital is hours away.
Time is of the essence because it takes so long for them to get to those patients, where we can get there in a fastly, timely manner.
In this job, time is crucial, life or death. It boils down to first responders having only a matter of seconds to safely airlift the patient.
Don't screw up. I try to remember all the things that I've been trained and try to be as helpful to the team as humanly possible and keep the patient safe.
Brad Smith is firefighter with York Fire. He says first responders need to be focused at all times. Air crews and ground crews need to act as one.
Many more eyes are on the scene, keeping watch on things that one person may not catch, and way more knowledge base with all those people. The more people, the better.
We're about to take off.
HELENA doesn't have a level 1 or 2 trauma center, so when air medical is requested, it's serious.
And it's really critical in flight that you stay 10, 12 steps ahead of whatever disease process or trauma, whatever's going on. We always try to plan out a few steps ahead of time.
Clear, left, right, and above.
The H-125 Eurocopter can go 150 miles per hour, holds 147 gallons of fuel, and can reach major hospitals in places like Salt Lake City or Seattle so they can receive the life-saving care they need.
And it's just different from sitting in a bed. We're in a bed in the air at 24,000 feet with this one flying somewhere, so we have to have our ducks in a row.
Travis Weiss is RN and CCRN flight nurse for Reach Air Medical Services. He says his job is fulfilling as it is an opportunity to save lives every day.
Oftentimes we see our patients again, see how well they do. They stop by or we run into them around town, and it's nice to really get that contact and closure on it.
I'm just blessed to do what I love to do and to fly in this beautiful state and help people that are critically injured or sick.
Lindsey Ford, MTN News, Helena.